Greenwich is a large borough, very close to the centre of London, situated south of the river. Obviously it's famous for its tourist centres and it also has very affluent areas. But it's a large, diverse borough and there are lots of areas of high deprivation, so therefore it suffers from health inequality. So a very big difference in life expectancy depending on where you live. The Healthy Greenwich Network is a partnership, and we have the Head of Healthier Communities, representatives from the key funders in Greenwich, senior staff from the PCT, from Queen Elizabeth Hospital. The team also has a team leader and a coordinator, administrator based within the local authority, and then we have the leaders of each project. So we have the voluntary sector and the statutory sector represented, which is quite unique. Over the years, the partnership's become a lot more tight. There's a kind of virtual staff team across the projects and partners. There's very strong share of resources and expertise, and pretty much a single type of approach. So the way it works now is we will target a physical area of high deprivation, and we will carry out a community needs assessment. This is carried out again through partnership. We go into an area and we'll do a physical, social and kind of community audit to see what the needs are in terms of projects that will help address health inequality, the kind of projects we can provide. The consequence is that we have evidence and interest from that community to support us establishing projects, which some will result in being owned by the community. So first we'll do a kind of a walk round and a physical audit. Then we will have meetings with various community leaders, development workers, the schools, people in community centres. 5% of the population we will individually question. Then we will develop a report which we circulate to those people that have been involved. Then at the end of that we'll have an event to kind of present the findings of the report and the potential projects that could be established. So for example in Active for Health you might have walking groups, Tai Chi groups, swimming groups, and they might become independent because they might become self-sufficient.
My name's Nicola Nzuza and I work for a project called Greenwich Community Food Initiative. This project is run in partnership by Greenwich Teaching Primary Care Trust and Greenwich Cooperative Development Agency, who have a lot of expertise around setting up social enterprise. Now, not everybody can afford to buy healthier foods or can drive to a large supermarket that has a bigger range of more healthy, affordable foods. So Greenwich Community Food Initiative aims to overcome these barriers to healthy eating by supporting people to set up community food projects. One of our main areas of work is setting up food co-ops. Food co-op is basically a market stall that sells good quality, reasonably priced fruit and vegetables.
They have a lot of benefit. They don't need to travel far before they get what they want, because the stuff we sell at our store is a lot in comparison with the supermarket. Not expensive, within their reach, very affordable, and again, it's of high quality.
We set up the original food co-op on the Ferrier estate, and then we had a lot of interest from residents in other parts of the borough. So funding from Healthy Greenwich Network enabled us to expand the food co-ops. And we now have 15 market stalls run by Greenwich Community Food Co-op in different areas of poor food access across Greenwich.
In the other stores, their demand for fruits differ from the demand in this place. So you were able to compare the demand and able to know what area, the sort of what they want, compared with other areas. But once I've started, I know, once I say fruit, I know what it is called. I can actually tell the customer what he needs and what he wants out of it.
One of the other main projects that we run are the food growing initiatives. Now, food growing is a fantastic way to promote health. Not only do you get to eat the fruit and vegetables that you grow, you are exercising, you're physically active in the process, and it can also have a positive impact on your mental health. So Greenwich Community Food Initiative employs an organic food grower, and he supports a number of community food growing initiatives in Greenwich. Our largest food growing project is 341 Shooters Hill, and they've been supplying organically grown salad to local cafes and also to our food co-ops.
Primarily we're here to teach horticulture to adults with learning disabilities. All of our students live locally within the borough or very close by. We have discussions with the Healthy Greenwich Network every year to decide what we're going to grow and what they think they'll be able to buy back from us. They provide us with a lot of our materials and a lot of seeds, and obviously provide us with some additional expertise and encouragement, which is always useful. And they then take some of the vegetables that we grow and they're sold on within the community, and so the whole thing comes back round full cycle. I've yet to have anybody come here and spend time here that didn't get something out of it and wasn't able to be productive and learn some skills.
The other main project that we run are community cookery clubs, and a cookery club is run by a person from a local community who has been trained in nutrition and running cookery clubs. The cookery clubs run for 5 weeks and they aim to teach people how to cook in a healthier way, so cutting down on the fat and the salt and the sugar that they add when they're cooking. Greenwich Community Food Initiative also supports community catering businesses. Greenwich Cooperative Development Agency provides the business support, while the Primary Care Trust offers advice on healthier menus.
We had this crazy idea of providing fantastic, sustainable, healthy food at an affordable price to the masses. We went to the GCDA, who put us in touch with the HGN, the Healthy Greenwich Network. They were really instrumental in us starting the business and giving us support, and have done really since 2003. They were able to promote us with whatever resources they had, whether that was printing or including us in their website or just by word of mouth. And today the support they give us is really by using us as one of their preferred caterers for healthy events where they require healthy food. They're still spreading the word, which has had the knock-on effect of us being used by others and then being used by others. So there's been this kind of spiral. That kind of support is really fantastic.
Our project is a healthy living project. We like to think of ourselves as delivering health promotion and information. It's aimed at over 55s in the Borough of Greenwich, and we want to provide them with access to healthy foods as well. We also have a project at the Age Concern Day Centre, the Friday Food Co-op. It's quite successful because the clients are brought in by minibus and they're taken home, and they can physically choose the things on offer, which is something many of them, because they're physically frail, have not been able to do for many years.
It's very convenient, and it's also the food, the fruit is very, very good. The boy, I think, is wonderful.
I always get, because I like plenty of vegetables like cabbages, greens, everything like that, which I have a lot of. And I cook for myself anyway, with a struggle, but I do.
It's really important that we link in with these other projects and that we come together to promote the different things that are available in the borough that are delivered by the network. For example, we have a project running at the Sikh Temple in Woolwich, and that is our positive ageing project. And we have been able to draw in and bring in from our partners at the PCT a weekly exercise class, which is very successful with the clients there.
The exercise, the way she recommends us or she does for us, and we all participate in it. It is so useful, especially for the arthritic people and the blood pressure people and the diabetic people.
I had a back problem. They recommended to an acupuncturist, and that helped very much.
In every respect, we need their help, especially in the public places where lots of people they visit.
Age Concern runs 3 lunch clubs in the borough, and have been able to go into the lunch clubs, carry out satisfaction surveys, but also analyse the lunch club menus to check that they're providing the nutrition.
Currently we have the adult carers project, the mental health project, the young carers project. and we have good links with other Asian communities here, such as the GCRE, the Semi-Day Centre, and we're able to link in with the people that attend those support groups. The project aims to sort of raise awareness on a preventative measure, such as preventing obesity, high blood pressure, high cholesterol. And then forward. Keeping your back straight. Can you feel that pulling at the back? Good. That's good pain, yeah? And relax. We're able to offer this support in various Asian languages such as Gujarati, Hindi, Punjabi and Urdu, and that's with the support of volunteers.
In the cookery clubs we do teach them, we go through all those things about high blood pressure and how they can prevent all of that through what they're eating and how much exercise they should be getting. So, you know, it gives them good information in their language, because otherwise when they go to a GP or somebody, sometimes they're lucky they'll get a GP that may explain it in their language, but they don't fully understand when they've come away from that.
For them to come here on a weekly basis, and not only do they meet the other ladies in the group, they've actually built up a good network of friends.
Community health promoters work with people to address the most basic health issues before they become problems. Areas such as weight management, low-level depression or emotional issues, physical activity, diet, healthy ageing, stopping smoking or alcohol. A community health promoter can do a whole range of work, from a very brief intervention in a doctor's surgery where they may be working as a healthcare assistant, where they might spend 10 minutes with someone who's possibly overweight and would like to lose weight, and they will just signpost them to various services around the place. Or they might spend up to 6 hours in 1 hour sessions with a client looking at what the lifestyle health issues are and what are the underlying issues with that, and working with the person to support it and develop a health action plan. Health action plan can be anything from, I will read this leaflet on stopping smoking, and then the next week you come along, the health action plan might be, I will call the stop smoking service. Very, very simple, very easy. Or it might be something along the lines of, in the next 6 months I'd like to be a more manageable weight and have a healthier diet, and these are the steps that I'm going to take to do it. And what we try and focus on is what is actually achievable rather than what the dream is. We're looking at what realistic goals are and supporting people to do that. A community health promoter might identify that there is no physical activity classes on their estate, and we will see about how we can develop the programs there. We're listening to what people need and what the gaps are, what the barriers to service are, but we're also having people who are going out there saying, hey, there are these things that are available that maybe you didn't know about.
Volunteers Greenwich is a part of the network. It's a supporting and facilitating project to the partners. We basically help with all aspects of recruiting and managing volunteers. We work with the individual projects to plan their recruitment for volunteers. An important part of the network is to enable people in their own communities to become more actively involved in their health. Within the last year, we've recruited 248 volunteers. Each food co-op has at least 2 volunteers.
My name is Mildred, and I've just started here on vacations because I felt lonely because the children were at home and I wanted to do something, and then I decided to volunteer here. That 2 hours for me, it's quite valuable for me, what I learned from here. Yeah. It's quite good.
Active for Health have a number of ways of using volunteers within their project. They have the walk leaders who are recruited from the local community to run health walks in the borough.
The exercise is good, and I enjoy the company. I have no family. I need to get out and about, It's a joy to meet people and take them on walks, and it's a joy when they at the end of the walk say, I really enjoyed that, I'm glad I came, I'll be with you next week. Being with nature the whole time, the changing scenes of the year, the autumn, the winter, everything is different, and you get 4 changes of the year where you can show people what nature is all about and how it develops and what happens to it during the course of the year.
Active for Health is a community-based physical activity programme, and what we try to do is we try to develop the easiest ways possible for people who live and work in Greenwich to get as much physical activity as possible. And we're part of the Healthy Greenwich Network, but we actually sit within Greenwich Primary Care Trust. We go into the community and we find out what it is they want. The last thing we want to do is actually go and say, right, you need to be physically active, you need to do this, go. Because we know that that doesn't work and people don't take that on board. So we try to talk to them about why they should be physically active, telling them about the benefits, but then giving them the responsibility by asking them what would they like to do. And as a result of that, we set up our community-based programmes.
We did the training and we went on a few of the Greenwich festival walks, and then we decided what's wrong with our park. We do walk every Monday, various parks and places around here, but we feel better for it. We really feel better for doing it. Medical benefits are proven, blood pressure goes down, it helps lift depression, so it really is a wonderful, relaxing way of getting fit.
But the main thing is we like to get all types of people walking with us, regardless of health or other forms of disabilities they may have. Even wheelchairs we cater for, and lots of mums and children with their prams often come on the flat walks.
The type of work that we're trying to promote is anything from walking to Tai Chi, to line dancing, to sit and get fit, which is really basic chair-based exercise. So we're trying to provide a whole range of different activities that many different people from many different backgrounds and many different walks of life can actually enjoy and take part in community locations close to where they live, and build it around social networks so people enjoy coming and people continue to work together with their friends and people from their locality to take physical activity seriously. The Healthy Greenwich Network is a key part of the work we're doing, and linking the Active Health programme to the Healthy Greenwich Network really means that we can get our promotional literature, we can get the message out to the people of Greenwich.
We've been looking at the strategy for the future of the Healthy Greenwich Network and very much reviewing its strengths. Reaching hard-to-reach communities, engaging them in our work, understanding their needs and their interest, establishing projects as a result of those, and wherever possible, establishing projects that can become community-owned or independent social enterprise within the communities that are our priorities. And I think beyond that is to try to continue to reach those that are hardest to reach. The Bridges to Wellbeing project is very much an extension of the Healthy Greenwich Network, building on the work it's done in terms of recruiting and training local residents and volunteers to run things like the co-op, cookery clubs, chair-based exercise and walk groups, community health promoters. We want to extend that, target new communities, priority communities, to recruit more volunteers so that they receive a variety of different training to deliver this further. The challenge is to continue to understand the barriers that people are faced with in trying to achieve a healthy lifestyle and try and establish projects that help those people overcome those barriers. And actually they change from small communities to small communities. You can go 3 miles in Greenwich and you'll be faced with different barriers. But we also need to consider sustainability, a permanent change. So what we establish, we hope to be there way beyond the lifetime of the Healthy Greenwich Network.